How to measure a resident height in bed. So when this happens, it's because a resident can't get up. So when this happens is usually measure them from their top of their head all the way to their heels. But let's say you have a resident that is always curled up and doesn't like to doesn't like to be straight in bed. So you would measure them from their head to their shoulders, and then from the shoulders all the way to their hip, and then from their hip all the way to their knees, and then from their knees all the way to their heels. But that's how you measure somebody in bed. How to weigh somebody in bed. So with these, you have to get a mechanical lift, and some mechanical lifts has a scale on them. So when you go in the room, and you gotta make sure you let the resident know what's going to happen, and that we're gonna weigh them, and with the mechanical lift, and so we gotta make sure that we know the weight of their pad and the sling, because that's added on stuff. So you gotta make sure that you know the weight of those, and so you can subtract them from the total weight. So you gotta make sure that you put the sling under them, and you connect them, and then you lift them up enough where their butt is not touching the bed. They're just kind of like floating this much off their bed, and then you weigh them. It tells you right there, but you just gotta make sure that you subtract the added on stuff like their pad and the sling. How to measure and weigh a resident using the upright scale. So you gotta make sure that you let the resident know what we're going to be doing, and you gotta make sure that they're nice and dressed, and that they have not skid shoes, so they're able to get up and stand up and they won't fall. But so when we take them to the area of where to measure and weigh them, you gotta make sure that when they stand up to get measured, that they're standing against the wall, and you put the rod on their head, but not too tight, and then you lift it up, and then you have them sit back down, and then take them to the area where you're going to weigh them, and then you take them to the scale, have them face against like the scale, and then have them stand up straight, and have them like try not to make sure that they're not leaning or anything like that, but just be there and just weigh them, and then have them sit back down, and then take them to the room. How to administer an anemia. So with anemias, there's two types of anemias. There's anemias that are more solution based, and those take up to 20 minutes for the resident to keep in their inside of them. And then there's oil-based anemias that take longer, and those take up to 30 minutes to an hour to fully process in their systems. So with anemias, the process of that is you gotta identify yourself by name, and you gotta let the resident know what we're going to be doing to them. Explain the procedure. We gotta make sure we wash our hands and put on gloves. Provide resident with privacy with the curtain, screen, or door. Place bed protectors under the resident so we don't make a mess. Help resident on their left side sim position. So when we do that, we're just having them expose their butt, nothing else. Add lubrication to the bottle if needed. Ask the resident to breathe deeply to relieve cramps during procedure. Place one hand on the upper buttocks. Lift to expose just the anus. Ask the resident to take a deep breath and exhale. Use other hand, gently insert the tip of the tubing about 1.5 inches from the rectum. Stop if you feel any resistance, or if the resident complains of pain, then let the nurse know immediately. Slowly squeeze and roll the anemia container so that the solution runs inside the resident. Stop when the container is almost empty. Gently remove tip from the rectum. Continue to keep pressure on the container until you place bottle inside the what? Gently remove tip from the rectum, continuing to keep pressure on the container until you place bottle inside the box upside down. Ask the resident to hold the solution inside as long as possible. Help resident use bedpan or a commode or to get to the restroom. Raise the head of the bed if resident is using the bedpan. If the resident uses a commode or toilet, put on robe or not good footwear. Lower the bed lower the bed to its lowest position before the resident gets up. Remove the discarded gloves. Wash your hands. Place toilet paper and wipes within resident's reach. Ask the resident to clean his hands when hand wipe when first if he is unable to. If the resident is using the toilet, ask him not to flush when it's done, so that we and the nurses can look at what the resident has like the output of the anemia. When called by resident, return and wash your hands. Lower the head of the bed and lower the head of the bed if raised, and make sure resident is still covered. Do not overexpose the resident. Remove the bedpan carefully and gently cover the bedpan. Remove and discard the bed protector. Give perineal care if help is needed. Wipe from front to back. Dry the perineal area with a towel. Help the resident put on undergarment. Cover the resident and remove the bath blanket. Place a towel and bath blanket in a hamper or bag and discard disposable supplies. Take bedpan to the bathroom. Call the nurse to observe anemia results whether the bedpan or in toilet. Empty the contents into the toilet. Turn the faucet on with a paper towel. Rinse the bedpan with cold water and empty it into the toilet. Flush the toilet. Place bedpans in area for cleaning, or if clean, store and according to policy. Remove any discarded gloves and then wash your hands and make resident comfortable and return bed to the lowest position. Remove privacy measures, only call it within resident's reach, and we wash our hands. But after anemia, we gotta make sure that we let the nurse know, for her to look at to make sure that everything is good. How to apply elastic stockings to a resident. So usually elastic stockings are for residents who are diabetic to help circulation in the foot. So when we apply to them, we gotta make sure that we have gloves on, and we let the resident know that we're going to be putting on their socks on, so they're not startled on, oh, why are you touching my feet? But we gotta make sure that you get the elastic stockings and you kind of roll them up and then have them sort of like inside out and roll them up, so that when you put it on their foot, you just kind of like slide it and it goes all the way up to their knees. And if there's a flap open, there should be a flap open at the top of where the toes are at. If that's open, make sure that you put it that little flap not too tight. You gotta make sure that it's kind of like loose where you're able to cover their toes, but make sure that you put the flap sort of upside up, because if you put it down, you don't want to create any pressure sores on their foot. But make sure that you put it up so that they're able to breathe and they get the toes covered in case if it's a cold day or anything like that. But usually elastic stockings are for residents who are diabetic. Assisting a nurse with changing a non-sterile dressing. So we gotta identify ourselves by name. Wash your hands and explain the procedure to resident. Provide the resident with privacy measures like a curtain, door, screen. The nurse will prepare a clean, flat, dry surface for the dressing materials. Keep the plastic bags close by for immediate disposal of old dressing materials. You may be asked to open packages for the nurse or cut strips of tape. Cut pieces of tape long enough to ensure the dressing. Open square gauze package without touching the inside of the gauze. Put on gloves. We should have the gloves before you touch all this stuff. Only expose the area where the dressing will be changed. The nurse will remove soiled dressing, dispose of used dressing in proper container. Remove gloves and discard them in plastic bags, and wash your hands. So after we take off all like the nasty dressing, the old dressing, then you get new gloves on. So like, cause you had touched them, the old dressing, and then you're not gonna touch the new dressing with your old with that same gloves. So you're just contaminating the new dressing. So you gotta make sure that when you're done disposing of the old gauze, you put on some new gauze so that when you help the nurse out, it's your gloves are sterile too. Make resident comfortable. Remove privacy measures after you're done. Wash your hands. Be curious and respectful at all times. And you make sure that you cover the resident up, with their blankets, and you leave the room respectfully.